Hi guys, today we are going to study the anatomy of heart. See, anatomy of heart. Okay, so this is very important. Heart is important for us. So we should know the main anatomical things about heart, right? Okay. First of all, they will ask you where is the location of heart. The heart is located at the posterior mediastinum of thorax. Okay, posterior mediastinum of thorax. First of all, what is mediastinum? Mediastinum, it is a space between two pleural sac. Okay, that is in the thorax. So heart is located in posterior mediastinum of thorax. Located in posterior mediastinum of our thoracic cavity. Clear? Now, second important point is they will ask you in MCQ. They used to ask what is the weight of heart. Okay, so it is different, a little different in males and females. In males, it weighs 300 gram. Okay, females are heartless always, right? So it weighs little less in them. It is only 250 gram. So males are having how many? These males, they are having 300 gram. In females, it's 250 gram. Okay. Usually you used to say the size of heart will be like a closed fist. Okay, we used to say that. So size of heart is closed fist. Next thing what we are going to study is histology of heart. Okay, histology of heart. Now, histologically, heart can be divided into three layers. Okay, that is inner endocardium, middle myocardium, and outer epicardium. Outer epicardium. So these are the three layers of heart. Histologically, heart is having three: endocardium, myocardium, and epicardium, outer. Okay. Now the heart is enclosed in a double-layered seroferous membrane. We call it as pericardium. Usually you will have a confusion between pericardium and epicardium. Understand, heart itself, they are enclosed in a double fibroserous membrane, that is known as what? Pericardium. So you have to understand what is pericardium. See, pericardium, that is what? Heart enclosed in a double fibroserous membrane. In a double fibroserous membrane. That is called what? Our pericardium. Now this fibroserous can be divided into outer fibrous and inner fibrous. Okay. This fibroserous you can again divide into outer, we have what? Fibrous layer, and inner is what? Serous layer. The important thing that you have to remember about outer layer is the outer fibrous, that is the fibroserous is outer part, we have fibrous layer. The inner is again divided into outer parietal and inner visceral. Okay, so don't confuse. The heart is enclosed in a double-layered fibroserous membrane known as what? Pericardium. This fibroserous you can divide again into outer fibrous, and outer part is fibrous and inner is serous. This inner serous again divided into outer parietal and inner vessel. This you have to understand which one is pain sensitive and is non-pain sensitive. See, always remember outer parietal is pain sensitive. Okay, they can sense the pain, but inner visceral, they are non-pain sensitive. That is an important MCQ. non-pain sensitive, and they are supplied by what? Inner visceral. They are supplied by ANS, autonomic nervous system, supplied by what? ANS, autonomic nervous system. Keep in mind this. Okay, so inner visceral is having outer parietal and inner visceral. Outer parietal is what? Pain sensitive, and inner visceral is non-pain sensitive. That is an important histology part. Now, so you know the all the histology, right? Histology studied inner, middle, and outer. See, in middle myocardium, actually, what is the function of heart? Pumping function. Pumping is done with what? The muscles. Muscles are contracting. So we call it as the functional layer. Middle layer you can call it as functional layer of heart. Very important layer, right? Muscles. Myocardium. The all main muscles are in the middle layer. Now, next thing that they are used to ask is, you know, there is something known as pericardial fluid, right? Pericardial fluid. You know, pericarditis, there is a disease, right? Pericardial fluid. So when you have pericarditis or pericardial fluid is more, you will do what? Pericardial effusion. Okay, you will take it out. Pericardial effusion. Where they will ask you what is the location to do the pericardial effusion. What is the important MCQs? Where we do the pericardial effusion? It is just below the xiphoid process. You know xiphoid process, right? Just below xiphoid process. We are doing pericardial effusion just below the xiphoid process. While doing the thorax, we have done the xiphoid process. Remember, in the manubrium, after manubrium, we have xiphoid process. So we will do pericardial effusion in the xiphoid process. So these are the important histological things that you have to remember. Now, what are the different borders or different parts of heart? Okay, now we will see what are the different parts. See, heart is having one apex, one base. Okay, one apex and one base. So usually people used to confuse between apex and base. See, imagine this is the simple structure of heart. So heart is having 4 chambers. Normally when we say apex, what you will think? In your mind it will come, apex will be the above structure, tip. But for heart, you have everything, every time remember apex is here. This is the apex of heart and this is the base of heart. Okay. And the heart is having 3 surfaces. Heart is having one apex, one base, as well as 3 surfaces. You need to know what are these 3 surfaces and how are they named. Okay. See, it is having anterior surface, you can call it as, or sternocostal surface. Anterior surface or sternocostal surface. Second is medial surface, just medial surface, or you can call, then you have inferior surface or diaphragmatic. You know, inferior part of heart you have diaphragmatic surface. So these are the 3 surface of heart. Anterior, or you can call it as sternocostal. You know, sternum and costal means ribs, they are here. So you can call this the anterior sternocostal surface and the medial surface as well as the inferior surface of that. That is also known as diaphragmatic surface. It's very easy to remember, right? Now, it is having 4 borders also. Heart is having 4 borders. Upper border, lower border, medial border and lateral border. What are they? Upper border, medial border, lateral and lower border. Clear, right? These are the different borders of heart: upper, lower, medial and lateral border. Now, I am going to ask you some important MCQ asked in many competitive exam. You know, heart is having 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Clear, right? Now, the question is, Which chamber forms the apex of heart? Which chamber form the apex of heart? Apex of heart is formed by. So logically, what you will think by seeing the figure apex, you will think what? Right ventricle and left ventricle. But it is not right. The apex of heart is formed by only by what? Left ventricle. Remember. So this MCQ is important, right? Or will make, there is a chance to make mistake. So the apex of heart is formed by left ventricle. Clear? Now next second question. If they ask you the apex, they will ask you the base also. Right? Now they will ask you base. Okay. Apex is only by left ventricle. So you again they will ask for base. But base is formed by both right atrium as well as left atrium. I can't make a 3D image here. When you see the heart really, you can understand this. But theoretically, for answering MCQ, you have to understand or remember, base of heart is formed by right atrium and left atrium. But they are not stopping here. They will ask you how many portion. So right atrium form 2/3 of base and left atrium form 1/3 of base. And they both are, base is behind the sternum. Remember, base is behind the sternum. So this is a very important MCQ. Now next thing they can ask you is the anterior or sternocostal surface is formed by anterior, or the first surface, right? Sternocostal surface is formed by, remember, anterior, right? So if you get the 3D image, you can understand it is formed by a right atrium and right ventricle. Okay, keep in mind, anterior or sternocostal surface is formed by right atrium and right ventricle. Now they can ask you the inferior surface. This is what? Anterior sternocostal surface. Okay, now next thing they can ask you the inferior surface or the diaphragmatic surface of heart is formed by. See, remember, inferior surface or the diaphragmatic surface. Inferior or diaphragmatic surface. It is formed by right ventricle and left ventricle. Okay, remember, it is formed by right and left ventricle. No confusion there. Now they will ask you left border or left surface. Okay, the heart right part is goes here. Left surface of heart or left border is formed by what? Left atrium and left ventricle. Okay, left means this. So left atrium and left ventricle. That you can answer it very easily. Okay, left surface or the left border. Now what you are going to be confused is they will ask you the right border. Right border. Remember, a right border is only formed by right atrium. Remember, a right border is only formed by what? The right atrium. Keep in mind that. Now they will ask you for the auscultation purpose, for the clinical purpose, we need to know where is the apex of heart located. You know, they will ask you where is the apex. Apex of heart is in the 5th intercostal space. Okay, apex of heart is in where? Apex of heart is in the 5th intercostal space. Apex of heart is located in the 5th intercostal space. Now they will ask you from mid-clavicular line. Okay, from mid-clavicular line, how they are? They are just medial to mid-clavicular line. Now this is our clavicle. We have studied the clavicle. The clavicle, the midpoint of clavicle is mid-clavicular. To pass through our mammary gland. See, so here the mid-clavicular line. So they are medial to what? Mid-clavicular. Medial means just medial to the body. Or they can tell you, the other reference is 9 centimeter lateral to the parasternal line. Okay, 9 centimeter lateral to the parasternal line. Okay, so in MCQ they can give you both the reference. That is, it is medial or lateral to mid clavicular line. It is medial to mid clavicular line, but it is 9 centimeter lateral to the para. Lateral means just away. Okay, this is our sternum. Lateral to the parasternal line. Keep in mind the apex, where is it located. Now we will see different structures located inside the each chambers. Okay, we have to know the anatomical structures located inside each chambers. So this is our heart, the simple structure of heart. You know that we are having 4 chambers. Okay, simple figure. Okay, this is our right atrium, right ventricle, left atrium, left ventricle. You know, the all superior vena cava as well as inferior cava dump the blood to the right atrium. You already know it, right? So let's imagine this is our superior vena cava. Okay. In right atrium, there is one more structure here, a sulcus. Okay, or a crista. This is known as crista terminalis. There was an MCQ. Crista terminalis is located in. It is in the right atrium. The right atrium, we also have a coronary sinus. Okay, there is a sinus present here. I will mark in color. Let us see this one. We could see. This is in the right atrium. This is known as coronary sinus. We are going to study about coronary sinus. It is between right atrium and AV wall. Right atrium and AV wall. Okay. You know, we have one valves here, right? I forgot to mention that the valve is here. Here also. So what is this? The right atrium and right ventricle. What is the valve called? They are called what? They are called tricuspid valves. Okay. They are called, both are mitral valves. Sorry, they are called in the between right atrium and right ventricle. You call it as tricuspid valve. Okay, and this here you have what? Bicuspid. So this is one is tricuspid valve, and this is bicuspid. In future you will have confusion, right? Future you will have confusion. Everyone will have confusion because we are studying a lot. We are medical students. You can remember this, like when you are going to a shopping mall. Okay, you are going to a international Adidas shopping mall. So you want to buy some sports dress. Okay, so first you will buy, right, or try. Which one you will do? You will go in there and ask the officials to give you the dress that suit you. Okay, so first you will go, you will take one dress and go to a trial room. First you will try, right? You will go to the trial room. If it suit you, then you will buy. Or you are not like other abnormal people. Don't just buy. So we will first try, then we will buy. So you are trying the dress, then you are buying the dress. So in right part we have tricuspid and left part we have bicuspid. So this is tricuspid and this is bicuspid. Bicuspid is also known as mitral valve. Keep in mind, bicuspid is also known as mitral valve. Okay. So that is also important. So that is about the right atrium, and we have a comb-like muscle here. The shape of muscle is a comb. You can see comb, right? Comb is having. So this muscle in the right atrium is known as musculi pectini. Remember, musculi pectini is in the right atrium. It is having a shape of what? Comb. It is having a shape of comb. Now, the other important structures. Okay, other important structures. So if I make here, you will be confused. If I am making one more heart. Right atrium, right ventricle, left atrium and left ventricle. Now I am simply showing the conducting system of heart. Okay, conducting system you already know. It starts from our SA node, and here we have what? AV node. So to start from SA node, see the passage how it goes. It start from SA node to goes to AV node. There is a delay here, AV nodal delay. Then from AV node, there is a bundle coming, thick bundle. It is known as what? Bundle of His. This bundle of His will be divided into right bundle and left bundle. This right bundle again divided and form Purkinje fibers. So conducting system of heart goes like this: SA node, then go to AV node, then go to bundle of His, then Purkinje fibers. Okay, bundle of His right and left, right and left. So this one is what? SA node to AV node. Then you have bundle of His. This is our right bundle of His, right bundle, and this is left bundle, and these are Purkinje fibers. Purkinje fibers. Okay, PF is Purkinje fibers. Okay, this is a simple structure. You already know it, the heart conducting system, right? Now, thing you have to remember is, see, we have some structure in the left, both right ventricle and left ventricle. So I am erasing this, or you will get confused. Okay, so we have the valve here. You already studied. Now, here we have a structure known as and here they will be having some muscles. They will have connected. Okay, this is known as coda tendon. This is known as what? Coda tendon. Now, coda tendon. Now, there are some muscles here. In the left ventricle, we have two papillary muscles. Remember, the left ventricle, you are having two papillary muscle, but in right ventricle you are having three papillary muscles. Keep in mind that. I'm just erasing. So these are the same structure, but in left ventricle how many? Three papillary muscle. But in left ventricle the number is 2. Right ventricle it is 3. So that is also an MCQ. How many papillary muscles? Okay. So conductive system is clear. Other structures are clear. So only thing you have to remember is all these things. Okay. Now they will ask you the location of SA node. You can see the location of SA node. It is between superior vena cava and nearer to crystal terminalis. I will explain you that later. So we have SA node somewhere here. Okay. So that is also an MCQ. So these are the important things or important structures you have to remember in each chamber. So left ventricle is having two papillary muscles. Right is having three papillary muscles. So keep in mind that. So next we are going to study is we have to study the blood supply of heart. Before that, see, you know who is pumping the blood, right or left ventricle? Now both will pump. This will pump through what? We have an artery here. What is that known as? Pulmonary artery. And this is the biggest vessel, that is aorta. Okay. So the MCQ can ask here also. What is the pressure in pulmonary artery? That is equal to 5 to 15 mm Hg. Pressure in pulmonary artery is what? 5 to 15 mm Hg. Now they can ask you about, I told you the left ventricle is pumping the blood to the whole parts of body, right? So it is pumping with a high pressure. So the thickness of muscles in left ventricle is thickness of muscles in left ventricle is 3 times bigger than right ventricle. It doesn't mean left ventricle is big. The muscle here is very thick because they are doing high pumping function, right? So the muscles are how many times? It is 3 times thicker than the right ventricular wall. Okay, now we are going to study the contact system we have discussed and how much impulse they are producing. Okay, how much impulse they will produce each conducting system. Now we know what are the conducting system. First one is our SA node. SA node produces an impulse around 60 to 100. Okay, SA node produces a impulse of 60 to 100. They will ask you the location of SA node. SA node is located between superior vena cava and upper border of right atrium. Between superior vena cava and upper border of right atrium, upper border. Okay, so the MCQ they will ask you what is the location of SA node. It is here, somewhere here. So it is between superior vena cava and the right atrium, the main part of right atrium. Or they can give you can write it as upper part of sulcus or crista terminalis. They are located in upper part of crista terminalis. SA node is located in the upper part of crista terminalis. So that is a reference point for what? SA node. Now next one is what? Our AV node. AV node, they can produce around 30 to 50 impulse per minute. They produce 30 to 50. They are not that bad. They can produce 30 to 50. And after that you have bundle of phase. It is around 20. Then you have Purkinje fibers 10 to 20. Okay. So we call SA node as the pacemaker of heart because it is producing the highest and starting is from that. These all are automatic. It doesn't need any stimulation. It's working its own. It is having the property of heart is known as what? Automaticity. So that is coming first from the SA node. So these are the main things that you have to remember about the anatomical features of the heart for an MCQ oriented questions or exam. In the next video we will study about the blood supply of heart. Okay, so these are about the anatomical features.